Hello, Nation. We're going to give you a dose of Dr. E today that relates to the Diabetes Warranty Program. I can't tell you how important this is. It's just like our cars. You bring your car in at the regularly scheduled maintenance visits. Our cars should run better and last longer. Same with our bodies. So we're talking about the eyes, kidneys, nerves, and heart. So let's do one at a time. Eyes. Get a yearly dilated eye exam by an ophthalmologist that knows and is familiar with diabetic retinopathy. That's extremely important. You know why? There are no symptoms in the early stages. Anytime that you don't have symptoms in the early stages of any condition, screening is super important. Don't wait until your eyes start to hurt. It's way too late. Second, your kidneys. No symptoms in the early stages, which is why you have to do a yearly screening test of your kidneys. Now, your doctor will know what it's called, microalbuminuria, creatinine clearance. You might have to urinate into a jug for 24 hours. You got to keep that jug in the fridge, otherwise it may make the test invalid. Make sure you label it correctly. This is not lemonade. That's a joke. And now, nerves. Now, if you step on a pebble or a tack and you scream bloody murder, we're not worried about people like you. We're worried about people who are insensate. They're numb. They step on something, they don't realize it. 3-4 days, sometimes weeks later, they start seeing oozing from their socks. And by that time, you have an infection that may be way too far gone and lead to an amputation. But I think it's just important for you to realize if you have normal sensation, then you shouldn't need to worry about it because your nerves will take care of you. What about your heart? If you have type 2 diabetes, heart disease is pretty common, but you can also get heart disease if you're anybody on this planet, including type 1. And we talk about the ABCs. A is aspirin, B is blood pressure, C is cholesterol. Think about this. If your blood pressure is high and your cholesterol is high, it causes no symptoms. And that's why they talk about heart disease being a silent killer. And I hate those medical phrases because they're scary, but it's true. You could have really high blood pressure and cholesterol levels and not have any symptoms at all. Now, lastly, this is also extremely important. Tooth and gums. It turns out that the microflora in our mouths, they're there all the time. But if your blood sugars are higher than normal, they love sugar and they expand. And people with diabetes have a higher rate of periodontal disease, inflammation. That is tough because once you have periodontal disease, it's really hard to get rid of it. So you got to do exactly what I suggest. Brush your teeth twice a day. Floss once a day, at least 1 week before and after you go to the dentist. Read about it in Chapter 4 of the brand new 5th edition of the Taking Control of Your Diabetes book. And just to end you with a nice thought, if you don't follow the tooth and gum disease directions, you'll look just like this. See you later.